I'm in Dar-es-Salaam in Tanzania, and I've been asked to talk about the relation between progress of countries, development, and immunization. Immunization is a fancy word for getting vaccinated so that you are protected against the worst diseases. And Gavi, who organized the meeting here, is the organization in the world who gets the new vaccine to the poorest parts of the world. And that's one of the best ways to decrease poverty, because the children will survive and families eventually will have fewer children and they can go to school. This graph shows the background to vaccination. It shows all the countries of the world. Each country is a bubble. The size is the population and the color is where it's situated. The map is up there. Red is Pacific Asia, blue South Asia, green Middle East, yellow is the Americas, and brown is Europe. Dark blue here are countries in sub-Saharan Africa. And what I show down here is the size of families. The so-called Western world, or the industrialized developed countries, they had small families and low child mortality. This is 50 years ago, 1961, the year when Tanzania got its independence, the year when the aid organization was started in the rich country, like USAID in USA. And you can see then that these countries who were rich, they had very low child mortality and very small family, whereas the developing world here had large families and very high child mortality. There were countries in which 1 child out of 3 died before reaching school age. And they were in all sorts of continents, Middle East, Africa, Asia, and Latin America. Almost no one in between. So at that time, we really could divide the world into developed and developing, and these countries were trying to help these ones. One of the forms of help that proved to be most successful was vaccination. I will show what has happened with child mortality and size of family. Here we go. 1962, 63, you see child mortality is falling. Not only vaccines, also better sanitation. And then family planning takes off here in China. China goes to small families. Look at Latin America. They are following towards smaller families. Indonesia is there. This is Bangladesh catching up with India. Look, what a success story. This is Iran, Islamic Republic of Iran. And today we have a completely new world. We have most of the countries down here, and they have a child mortality still too high, but below 50 per 1,000. And the average number of children per woman in the world is 2.5. But you saw very clearly that first child mortality went down, then family size came down. But still, it's not completed. There is an urgency in completing this transition in all countries. That's Afghanistan, that is Congo. And those countries are suffering from civil war, which makes normal health service, normal school, good living condition impossible for the population. Other countries are just very, very poor. They need to complete the trip down here. I will show 2 countries which are of special interest. I go back to 1961, and then I pick Bangladesh in Asia, one of the biggest Muslim countries, and then Tanzania here in Africa, one of the most peaceful African countries that has a very low income, but has progressed well over the years since independence. Look what has happened in these years, in these countries. Child mortality went down. First, Tanzania was more successful. Then after independence, Bangladesh became very successful and also decreased family size, whereas Tanzania just got child mortality down very successfully, but family size is still relatively high here, 5 to 6 children per woman. Whereas look at Bangladesh. Although they are poor, they both have a low child mortality and almost 2.2 children per woman. So the population growth will stop in some more decades in Bangladesh because each father and mother is now replaced by 2 children. Now, you can also see here that there are many countries still up here which have far too high child mortality, and they need more vaccines, because in the past there were no vaccines for the main killer disease of children, diarrhea, pneumonia. You know, those are 2 major killer diseases. Just recently we got those two vaccines. And there's a danger with showing data like this, because I show the average of a country. I will go in here and split up Tanzania. What I marked here is just how an average family looks in the poorest part of the world. Father and mother get 5 children, 1 die before growing up, but still 4 survive. It's a little counterintuitive, but it's the countries with the highest child mortality that have the fastest population growth today. What is needed is that more children survive, and then the father and mother would say, let's go for 2 children. Let's invest in our children, because now they don't have diseases, they don't die, they are healthy. Let's have them go to school. We'll work hard for that. That has not happened in all countries over here. Look at Tanzania down there. I'll split Tanzania into different income groups. The best of 20% in Tanzania that has gone most to school, that has higher income than the others, they are among the Asian countries here, quite successful. It's not that Africa and Africans have many children, it's people who are poor who have many children. And people whose children are dying, they are having many children. And look at the poorest 20% in Tanzania. They are worse off than Afghanistan. This country has such a diversity, successful in the front, still much to do in the poorest part of the country. It's quite good vaccination in this country, but it's not reaching all the way out to get everyone. And we are waiting for the effect of the 2 new vaccines which are being rolled out. Here I show the main killer diseases in the world. There's about 7 million children dying every year in the world, and they are mainly in the poorest countries. Each block here is 100,000 children dying. This one represented HIV/AIDS. There's 100,000 children dying from HIV/AIDS every year in the world. This one is malaria, 500,000. This one is diarrhea, almost 1 million. And this is pneumonia, infection in the lungs. And that one kills more than 1 million. This is the biggest one. It's newborn diseases. Those children who die just after birth or during the first week or month after coming to this world. Now, that demands a little more health service. What we really need to do is taking these diseases away. And the good news today is that Gavi is helping countries to access the new vaccines for these 2 diseases. Rotavirus, one of the most terrible causes of diarrhea, can now be vaccinated against. It was costly when it was developed, but now it will be made available even for poor families throughout the world. And there are 2 vaccines which will prevent against the worst bugs, the worst bacteria that kill children by infection in their lungs. It's a terrible disease. Children are suffocated by the infection in their lungs. And antibiotics can save them, but that also have a problem with resistance. So it's really good news with these vaccines against pneumonia. I will show you a little more about the relation between child mortality and money. Now you recognize my bubbles. Same color and size as last time. The big China and India here. Here also child mortality. But I changed the scale. I pressed the high child mortalities together and I expanded in the low range of child mortality so that you can see the whole variation in the world. This world actually varies from 200 children dying down to 2. But I start in 1961, and then there were countries which had almost 400 children per 1,000 dying. Imagine, 4 children out of 10 died before starting school. Here is money. It's the economic level of the country. $1,000, $10,000, $100,000. In 1961, richest in the world, United States of America. Also, they had relatively low child mortality. But my own country, being a lucky one, not having had war for 200 years, we actually had the lowest child mortality. We had had time to build a health service, to vaccinate with existing vaccines and provide the best care for children. And then followed the countries in Europe here, and the rest were up here with very high child mortality. If I drag this down, you will see that the relation between money and child mortality is becoming sharper. But look, with new vaccines, new antibiotics, more knowledge about breastfeeding and vitamins to children, then child mortality is getting down relatively fast. Some countries have backwards periods in the economy, and then they go forwards. But especially the last 10 years have been very successful in the world to get child mortality down. And this is the pattern we have today. Look, it's almost a straight line. This means that you can use your money well in a country. You can reduce inequity so that everyone have access to the health service for children. But then you hit a level beyond which you cannot go if you are not richer. This is Vietnam. Vietnam is by geography and political history a country of good equity. Everyone have access to health service, yet they cannot go lower if they don't get richer. Because it becomes more and more costly to have a ward for the newborns in the hospital, to do all the cesarean sections that you need to treat those with congenital malformation. Cuba is there, also a country with great equity. But they are not rich enough to come all the way down to the world champion, Singapore. Fantastic. Sweden never thought that Singapore would beat us, but they did. They have the healthiest children of the world. And United States, they have the money, but they are not so good at giving resources to all children. Low child mortality, but they could do better. And this relationship really shows us there's no clear division between developed and developing countries. Rather, there's a range from Congo up here to Singapore. You find countries on all sorts of child mortality levels and economic levels. So where is the line between developed and developing countries? I hear people all the time talking about this. Even at this conference, they talked about helping the developing world. Now, let me show you here. See the graph we just saw? This line is very interesting. It's Gavi, the organization now who take their partners together for this conference. They have drawn a clear line. They say, if the country earns more than $1,500 per person, they should be able to pay for their own vaccines. If it's lower than that, we'll coordinate different organizations from Bill and Melinda Gates Foundation to bilateral government aid organization and other donors. They coordinate and they acquire the vaccines after very smart negotiation with the industry that makes the production sustainable. Not only buying a cheap vaccine for 1 year, but making something that can work for the future. Here they need help with that, the countries. From there on, they should be able to do it themselves. And you can see very clearly, it's almost most of the world is on that side. So is this a cruel organization? I don't think so. I think they are smart. And I'll show you why. Because I can compare with the line of development aid, which is by OECD. OECD is the club for the rich world in Paris. And they have an aid line. They say, everything you give to a country which have less than $12,000 is considered as development aid. And then they used to say these are the developing world. Look what the difference between Gavi's line and this line. China is there, for instance. Should you give aid to China? If I can express a personal view, I think that countries that buy car factories in Sweden and that lends money to the United States, they should also have the money to pay for their drugs for their people and their vaccines, and they are very competent in China also. So they should manage for their own. Brazil, likewise, many of these countries should do it. And Gavi is not like stopping 1 year. They have a graduation process of about 5 years when countries gradually can build up their budget. Because vaccination is something that just goes on year by year for all new children that are born. So what do we mean then with developing and developed countries? I took a publication here that I read every year from United Nations. It's a very good publication. It's about child mortality in the world. Highly competent specialists from different United Nations organizations come together, merge all the data, present it on a web in a very qualified way. I can really recommend this. It's the best source of data on child mortality. But they have one problem. It's their definition about developing and developed countries. So I took the data from this publication and displayed child mortality on this graph, and I took from the World Bank the data on economic level. And then I looked which one, because they document everything here. They have regional classification in the back here. And I documented that, and then I draw a line between developing and developed countries. And you would think that it would follow this line, but it didn't. They decided that Kuwait and Qatar, the richest countries in the world, they were developing. Probably because they have deserts and are Arabs. And South Korea is a developing country. Then they included Greece here and say they are developed, whereas Singapore down here is considered a developing country, one of the richest and healthiest countries in the world. And the line continues in a very strange way. Russia is developed, but Malaysia is not developed, and Cuba is not developed. And then they take Albania as developed, and look, Republic of Moldova that have had so many problems, they are developed. I mean, considering that this is an organization sponsored by Bill and Melinda Gates, they have a very simple line. It's a straight line. This is an extremely advanced line. Have they been thinking? No, they are just conventional. They are like if they are driving, they are looking in the hind mirror, how the world was in the 1940s when UN was formed. It's the diplomatic limitations. And this is how the Millennium Development Goals are reported. Which one is developing country and not developed? We need to change that. I think Gavi has done things in their analytical works and how to make deals with the corporate sector that are as important as the fact is that they provide the new vaccines for the poorest children. They have really built a system that can be used in very many ways. And I will prove this to you by going back to my interactive graphs. I will change the colors here and let the colors show the size of the family. By now you understand that I'm quite concerned by the size of the family. Not that I think that we in any way should, as was done many years ago, you thought you could force poor people to have fewer children. That's wrong to do, and it doesn't work. But today in Tanzania, 25% of the adult women want to have family planning because they see their children are surviving. They're getting vaccinated. They have treatment for malaria. And then they would like to have family planning. Look, all countries which are below 40 per thousand in child mortality and which are richer than 3,000, remember the Gavi line? This is the Gavi line. All beyond that, they have blue. They are blue here because they have 2 child families or less. Blue is 2 children per woman. This is 4 and 6 up here. So high child mortality goes with many children per woman, whereas they are low here. Even Bangladesh, you remember Bangladesh, have provided family planning in a very big move in the whole country where even religious leaders, the Muslim leaders, they contributed, to inform that family planning is good, and they showed the text. The Minister of Health from Bangladesh just told me that there are texts in the Quran that support that you should plan the family for the welfare of the children. Here we can see that Gavi's line is relatively smart because it's why child mortality is so high, so parents give birth to many children. That's why you need vaccination as fast as possible. Now I'll do another thing. I'll change the size of the bubbles so that the size of the bubbles will show the number of children who die. And I have number of child deaths here. And you see that all the bubbles on this side of the Gavi line has relatively few children who die. There is always congenital malformation, traffic accident, cancers, and so on, And China and US are very big population, have many children born. That's why they're here. But I think just what I've shown here, the size of family, where the children are dying, it makes really sense to not follow the old convention of aid line is here and call everything developing world. Be sharp and analytic, because then the money, the aid money, which help these countries, will make so much more good, will save so many more children, and really will be strategic for the improvement of these countries. Because when you get fewer children, you can give them longer education, and the whole country can thrive from that. So, what do we learn? Well, we learn that Gavi did 2 good things. UNICEF were already doing good things when Gavi started. They were providing the old vaccines that were already cheap. Now Gavi could add the new. We have United Nations Family Planning Association here. We have WHO. They don't have the corresponding organizations. Yet, we know that the world is failing the poorest countries now in family planning. We know that the middle-income countries now are desperate need of cheap drugs for treating hypertension, cancer, mental disorder, which is called non-communicable diseases. Because when vaccines are there, when malaria nets are there, when infections disappear, then countries get the same sort of diseases that the rich world has been suffering from during the last 50 years. So, this is my private suggestion. I think that the experience from Gavi can also be used beyond the vaccine. So why don't we form a GAFP? It's not a very nice acronym, but Global Alliance for Family Planning. Many are doing good things now, but they could come together in a more coherent form. And I know that very many are thinking about GANCT, the very bad acronym, you know, Global Alliance for Non-Communicable Disease Treatment and Management. This is what I learned here in Dar-es-Salaam, that Gavi is doing two things. They are getting the new vaccines out to the poor countries just some few years after they have been put on the market in the rich end of the world. And they are doing that in a very clever system that we can make use of for other urgent needs. Thank you very much for listening.